Hi, my name is Vonne Solís. I want to introduce you to the Trauma and Grief series that I am kicking off here in May 2019. It's taken me a really long time to go public with my trauma, but I do live with post-traumatic stress disorder, commonly known as PTSD, which was diagnosed in 2014. It was a result of the suicide of my daughter, and behind me you will see a picture of my beautiful Janaea, who took her life in 2005 at the age of 22. So the series that I'm going to take you on a journey on over a period of weeks or months, however long it lasts, showing you beautiful spots on Vancouver Island where I live, the natural beauty. Sometimes we'll be going to oceans, maybe forests, but the point of that is how important nature is to healing trauma and certainly calming some of the symptoms. So what I wanted to do with introducing this Trauma and Grief series is, one, put a more public face on trauma and grief, which is really not talked about and not understood. Not really a lot by medical professionals, and it's certainly not understood by grievers themselves. Because I am a bereaved parent and I've been living with post-traumatic stress disorder essentially from the moment my daughter ended her life and I found out, there are so many topics I want to talk about and make public, mostly for grievers, so that they themselves can become aware of symptoms they may be living with and attribute them to trauma rather than making themselves go really crazy. So there's a number of things I want to talk about. This is going to be very ad-lib, just very natural, because one of the things when you live with PTSD or have been traumatized is everything goes out the window. So there really can't be a lot of planning, at least not in my experience. Everything is in the moment, in the present, in the sense of limitations, not being able to plan for events in the future. You might make an appointment to go somewhere, an event, tickets for an event, that sort of thing, and then on the day of, you just really can't go. So I've had to really learn to just live presently, day by day, and manage symptoms that I only really came to understand in the last, I would say, year and a half. I do see a psychologist, but we're not working with my trauma. And a key piece to what I have recently found out about living with post-traumatic stress disorder is how reticent what they call in psychology the trauma survivor is to getting help. And there's a number of reasons for it, but in my own personal situation, a lot of it has to do with lack of trust. A lot of it has to do with not knowing what you're dealing with, and certainly a lot of it has to do with who wants to go back and visit their actual traumatic experience. But in fact, going back and visiting your actual traumatic experience, that moment that put you into traumatic stress, is something that is really key for healing at some point. I'm really honest in saying I have not done it myself. I'm not ready to do it. Instead, what I'm doing is learning as much as I can about trauma and post-traumatic stress disorder, the symptoms, the latest treatments, and of course, lots of things to do with self-management and self-healing. It's going to be quite a journey, and it's going to be one that I'm going on as I learn more things, and I want to share with you, and I feel brave enough to put myself out there in a public space, knowing how there are or could be lots of negative comments. But the bottom line for me is I have long felt that if you want change, you have to be the change, and I have waited years, nearly 14, for this topic to become more public and more recognized. It is not happening So we do it on our own. So for those of you who are bereaved parents, have lost a child suddenly, have lost a child to suicide, you're not my only audience, but you're a very, very big part of who I want to reach. Understanding that there are many, many, many other people out there traumatized and living with post-traumatic stress disorder. But in some of those situations, their trauma is recognized in the public space. Psychologists are better prepared and know how to deal with other kinds of trauma. It's being extended now to include first responders, the police. I even discovered last year they're recognizing in the public space trauma that jurors actually can experience. But not once, to my knowledge, has trauma been attributed to grief, and specifically bereaved parents and the loss of their child, though it has reached the area of understanding and interest is a better way of saying it, by some doctors for parents that go into post-traumatic stress disorder from dealing with a sudden illness, terminal or otherwise, of their child, and doing studies on what they go through in the hospital experience. I am so hoping and wishing that we can just push this a little bit more and understand that for every first responder, for every policeman that's there, for every victim crisis worker, and anybody else involved in the death of our child, sudden, by suicide, car accident, whatever, that and where it's recognized that they may develop post-traumatic stress disorder, what about the parents? We're actually left with the trauma, the symptoms, the shock, the aloneness, and everything else we're going to talk about in this series, with not very much support available. Now, while I don't really want to, be critical of the psychological, psychoanalytical field, and those that really, really have good intentions to support those in trauma. Again, I just finished a several-week webinar series by the leading trauma center in the United States, and not once again was any trauma or post-traumatic stress disorder mentioned in case examples or in general related to what a bereaved parent and their family members actually go through when losing a child. So again, if you're not a bereaved parent and you're interested in this series and you have trauma from grief from another type of loss, there may be something valuable that you can take from this series as I learn more and more and share and work with my own psychologist, although nothing that she ever says would be made public, of course. But it's more just gathering the information and having self-knowledge so that you can go out and reach for help when and as you feel ready. In some cases of trauma that doesn't turn into post-traumatic stress disorder, there are lots of what they call self-soothing measures, and we'll talk about those along, as we go along in this series as well. And I am an example of somebody who, once I had a diagnosis of PTSD, had no choice but to learn techniques so that I could manage my symptoms and allow that to turn into more self-soothing. Of course, self-soothing depends so much on everybody's circumstances, their life experiences, what they're able to do, and in what time frame. But I will say this, that of all the changes that you will go through as a bereaved parent or in any other kind of grief, things do change, things do evolve. You do go one step forward, you do feel like you're taking 10 back. But the point is, we are always moving forward. I make a distinction between moving forward and moving on, because the term moving on for me is very, very misused, and I don't think that it's actually appropriate. to use in grief, in any sense of the word, in any type of grief experience. But I do recognize that we have to move forward, because getting stuck in time, getting stuck in the experience, getting stuck in anything is really not healthy or does anybody any good, including extended family members, when you're all trying to work so hard to recover from a loss.